Beta variant, also known as lineage B1.351, is a variant of SARS-CoV-2, the virus that causes COVID-19, one of several SARS-CoV-2 variants believed to be of particular importance. It was first detected in the Nelson Mandela Bay metropolitan area of the Eastern Cape province of South Africa in October 2020, which was reported by the country's health department on the 18th of December 2020. Phylogeographic analysis suggests this variant emerged in the Nelson Mandela Bay already in July or August 2020. The World Health Organization labeled the variant as beta variant, not to replace the scientific name but as a name for the public to commonly refer to. The WHO considers it to be a variant of concern. Amino acid mutations of SARS-CoV-2 beta variant plotted on a genome map of SARS-CoV-2 with a focus on spike. Footnote 1 presented in parent lineage B.1. Source Teagley et al. Supplementary Fig S8. There are 3 mutations of particular interest in the spike region of the lineage B1.351 genome, and a further 5 spike mutations which have so far generated less concern. Away from the spike region, it also carries K1655N, SGF3675, 3677 deletion, P71L, and T205I. Scientists noted that the variant is able to attach more easily to human cells because of 3 mutations in the receptor binding domain in amino acid position 501, K417N, and E484K. 2 of these mutations, E484K and N501Y, are within the receptor binding motif of the receptor binding domain. The N501Y mutation has also been detected in the United Kingdom. 2 mutations found in the beta variant, E484K and K417N, are not found in alpha variant. Also, beta does not have the 69 to 70 del mutation found in the other variant. On the 4th of January 2021, UK newspaper The Telegraph reported that Oxford immunologist Sir John Bell believed there was a big question mark over the new South African variant's potential resistance to COVID-19 vaccines, raising fears that vaccines might not work as effectively on that variant strain. The same day, Sabir Madhi, professor of vaccinology at the University of the Witwatersrand, commented to CBS News that it's not a given that the new beta variant would be able to evade the vaccines, but that it should be considered that they might not have the full efficacy. The additional mutations to the spike protein in beta were raised as a concerning factor by Simon Clark, an associate professor in cellular microbiology at the University of Reading, in that they may make the virus less susceptible to the immune response triggered by the vaccines. Lawrence Young, a virologist at Warwick University, also noted that the variant's multiple spike mutations could lead to some escape from immune protection. The E484K amino acid change, a receptor binding domain mutation, was reported to be associated with escape from neutralizing antibodies, which could adversely affect the efficacy of spike protein-dependent COVID vaccines. The E484K spike mutation was linked to a case of reinfection with the beta variant of SARS-CoV-2 in Brazil, believed by researchers to be the first such case of reinfection involving this mutation. The possibility of an alteration in antigenicity was referred to as an escape mutation from a monoclonal antibody with the capability of neutralizing the spike protein variants of SARS-CoV-2. This suggests that existing vaccines can and should be updated to counter the new strains without recourse to phased trials. In January, Johnson & Johnson, which held trials for its Janssen vaccine in South Africa, reported the level of protection against moderate to severe COVID-19 infection was 72% in the United States, but 64% in South Africa. On the 17th of February 2021, Pfizer announced that neutralization activity was reduced by 2/3 for the beta variant, whilst refraining from making claims about the efficacy of the vaccine in preventing illness as a result of this variant. On the 16th of March 2021, The South African Health Products Regulatory Authority approved the Pfizer-BioNTech vaccine for Section 21 Emergency Use Authorization on the 1st of April 2021. An update on a South African vaccine trial stated that the vaccine was 100% effective so far, with 6 of 9 infections in the placebo-control group being the beta variant. However, 9 days later, an Israeli study found that the variant was present even in people who had received both shots of the vaccine. Its prevalence a disproportionate, 8-fold increase amongst vaccinated individuals in comparison to wild strains. On the 5th of May 2021, a letter summarizing results from the Qatar National Study Group for COVID-19 vaccination showed 75% effectiveness against infection, with 0 cases of severe disease. On the 6th of February 2021, the Financial Times reported that provisional trial data from a study undertaken by South Africa's University of the Witwatersrand in conjunction with Oxford University demonstrated reduced efficacy of the Oxford AstraZeneca COVID-19 vaccine against the beta variant. This too